The Newsday continues here on One News Now. I'm Riza Diaz. The initial shipment of Sputnik V COVID-19 vaccines have arrived in the Philippines. At least 15,000 jabs serve as test order that forms part of the first 500,000 doses to be delivered to the country. The vaccines were supposed to arrive on April 28 but were delayed due to logistical concerns. The delivery of 2 million doses of the Russian-made vaccines in total is expected in the second quarter of the year. Now, as the first world starts to ease restrictions and open up borders to vaccinated individuals, it's a different story in third world countries where COVID-19 infections and deaths continue to rise. Let's watch this from Bloomberg's Wall Street Week.
Larry Summers calls it a tale of two worlds. The United States is lifting COVID restrictions. Europe is getting ready to open its borders to vaccinated Americans this summer. And bars and restaurants in Great Britain are open for business again. But countries like Brazil and India are just now facing the worst of the pandemic.
And naturally, the system starts creaking. I mean, it happened in New York. It happened in many cities of the United States. It happened in Italy.
Brazil has now recorded more than 14 million COVID cases and 395,000 deaths. But President Bolsonaro opposes lockdown measures and has tried to reverse restrictions imposed by local authorities. Brazil's Congress has launched an inquiry into the government's handling of the coronavirus pandemic.
These are places where we have to have a global community because we also have to understand that the viruses that are present there will eventually move out and enter other parts of the country.
A similar story in India. Until March, India was recording fewer daily new cases than countries like Germany and France. But now a giant second wave makes India the world's hardest hit nation.
The situation in India right now is, shall I say, dire, all across the country.
India is breaking world records with more than 350,000 new daily infections and more than 3,000 deaths per day. But officials estimate that the number could be 10 times higher than that because of lack of testing outside of big cities and poor reporting. Prime Minister Modi's leadership is coming into question with the surging caseload. He and his top ministers encouraged vast gatherings of unmasked people at jumbo election rallies and at a month-long Hindu festival that brings millions of pilgrims to a small town on the Ganges.
I think there was a perception that that COVID had been done and dusted back in January, February of this year, and everything was opened up, the rallies, the gatherings, the weddings. Obviously, given the situation right now, it was a mistake.
Now the nation faces severe oxygen shortages at hospitals and is turning to the world for help. The White House is lending a hand by sending PPE, ventilators, and test kits.
We are sending immediately a whole series of help that he needs, including providing for those remdesivir and other drugs that are able to deal with this and prevent, in some cases, but help recovery.
Now, as for the latest on COVID-19 in the country, the health department reports over 9,000 new infections. That brings the country's case tally to over 1,046,000, some 72,000 of which are still considered active. The virus claimed the lives of 120 more patients in the past 24 hours, pushing the nationwide death toll to more than 17,300. Now, some 957,000, meanwhile, have gotten better from the disease, with over 10,800 new recoveries reported today. Local regulators will be investigating the unauthorized distribution of anti-parasitic drug Ivermectin that was held in Quezon City last Thursday. This as two lawmakers distributed the drug for free, despite no evidence it can treat COVID-19. Health Secretary Francisco Duque III said health workers raised concern about irregularities in the medical prescriptions that were distributed. Duque stressed even if the Food and Drug Administration had granted select hospitals special permits to prescribe Ivermectin, there are conditions attached to it.
So, kailangan yung pangalan, ano yung side effects, gaano katagal, ibinigay, ilang doses, ano yung beneficial effect, hindi lang side effect. So, marami dapat inire-report sa FDA as part pharmacovigilance of FDA. Kung kulang siya, then there is a violation. And PRC will look into this, no?
But in an interview with 1PH sa Totoo Lang, Anak Kalusugan Party List Representative Mike Defensor dismissed the health department's concerns as petty. In a statement, Defensor also asked DOH to spare the volunteer doctors, saying he and fellow Ivermectin advocate Sagip Party List Representative Rodante Marcoleta should be held liable for the distribution of the anti-parasitic drug that is mostly used for animals. India posts a record daily rise of nearly 402,000 new COVID-19 infections in the past 24 hours. A professor from the Johns Hopkins University says what's happening in the country could serve as a warning to the world. Let's watch this video from Bloomberg.
Joins us now for more. So, Nisa, thanks so much for being with us today. I mean, everyday things in India seem to be getting worse. The pictures are just horrifying to look at. How much of the global fight against COVID should be directed towards India? I mean, should the U.S. be putting even more resources towards the country at this point?
Well, you know, Jennifer, first of all, thank you for reporting on this story, because it's such an important story. Because if we don't learn from India, we may be in the same place ourselves. So yes, I think that it's important for people to get together. I've talked about this since the beginning of the pandemic. This is not just one country's response. In order for us to battle this, we need to do this in a unified manner. I really like what Amazon and Gilead and some of these different companies are doing. India is the world's largest democracy, right? So there is some infrastructure there. So what's concerning is to see how all of this health system is crumbling in the face of this pandemic. And what can we do to not have history repeat itself here in the United States?
Can you talk about that a little bit, Nisa? Because I'm confused about, here we are with vaccinations having done so well. Is the concern that this could again happen? And I say again because we were in such a bad place a little over a year ago here in the U.S. and back in December, January, too, thousands of people dying a day. How could this happen here in the U.S.?
So, Tim, that's a really good question. But again, you look to India, they were pretty strong on their vaccines, right? They developed their own vaccine. They had a really strong campaign going. And then they got hit with some big super spreader events and some other pieces, right? So what can we, it's not that we're going to end up there, but what can we learn from this? So we have to continue really strong with our vaccine rollout. We have plenty of vaccines now. Our next step is to get them into as many arms as we possibly can. Because when you talk about New York reopening, right? Anytime you're going to put people together in a space, whether it's Broadway or whether it's a restaurant, and you have vaccinated and unvaccinated, and you have variants, you're creating a situation where you could cause this pandemic numbers to increase in New York.
Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.